Welcome to the latest edition of Endocrinology Updates, covering breakthroughs in the past 2 weeks. Brought to you by Lucid Quest. Debiopharm has randomized the first patient in OXTEND-III, a global phase 3 study of Debiopharm 126, a long-acting octreotide. About 120 adults with acromegaly across 75 sites in 21 countries will test whether quarterly injections can sustain IGF-1 control while cutting injections from 12 to 4 per year, aiming to ease treatment burden. Abbott and the FDA have flagged certain FreeStyle Libre 3 and Libre 3 Plus sensor lots for falsely low readings. About 3 million sensors are implicated, with 736 adverse events and 7 deaths reported outside the United States, potentially linked. Affected users should stop using the sensor and request free replacements, while readers and apps are not impacted. China's National Healthcare Security Administration will add Mounjaro, tirzepatide, to the national reimbursement list for type 2 diabetes on January 1, 2026. Inclusion typically broadens access while lowering price per dose in a market with very high diabetes prevalence. BioRep Technologies reported the first successful independent human islet isolation with the PRISM system at the Scottish National Blood Transfusion Service, in collaboration with Leiden University Medical Centre. This automated, closed, modular platform aims to replace aging equipment such as the COBE 2991 as it is phased out at the end of 2025, supporting reproducible research workflows. In the INHALE-1 trial, a 26-week randomized study in youth mostly with type 1 diabetes, inhaled Technosphere insulin did not meet the pre-specified non-inferiority margin of 0.4% for HbA1c versus subcutaneous rapid-acting analog insulin. The adjusted difference was 0.18%, with similar CGM metrics. Inhaled insulin showed less weight gain, 1.6 kilograms versus 3.0 kilograms, higher treatment satisfaction, and a 17% rate of cough. Early discontinuation occurred in 22% of users, with hyperglycemia the most common reason. Wellgistics is launching Brenzavvy, bexagliflozin, across a network of 6,500 independent pharmacies. The EinsteinRx platform will prompt pharmacist outreach, targeting underuse of SGLT2 inhibitors, and offering a cash price alternative to branded competitors for many of the 33 million diagnosed adults with type 2 diabetes in the United States. A meta-review in NPJ Digital Medicine synthesized 60 studies on AI-enhanced wearables for type 2 diabetes and prediabetes. Many systems predict glucose changes 1 to 2 hours ahead and triage data for clinicians. Key gaps remain, including explainability, external validation, benchmark datasets, workflow fit, and access. In Europe, the EMA has extended Mounjaro's indication to children and adolescents aged 10 years and older with type 2 diabetes, as monotherapy when metformin is not appropriate, or as add-on therapy, alongside diet and physical activity. Also in Europe, the CHMP issued a positive opinion for Wegovy 7.2 milligrams. In the Step-Up program, adults with obesity and without diabetes lost an average of 20.7% of body weight at 72 weeks, with 1 in 3 achieving at least 25% weight loss. Safety and tolerability were consistent with the 2.4 milligram dose. A final European Commission decision is pending. Stay ahead in endocrinology research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@